Stress physiology, the real cause of diabetes that we misunderstood. Hi, everyone. This is Real Easy Med Terms. In this session, we will learn about stress physiology, the real cause of diabetes that we misunderstood. Chapter 2. What is insulin resistance? 2. What is insulin resistance? When insulin binds to the insulin receptor on the cell membrane and gives the command to activate the glucose transporter on the cell membrane opens and glucose diffuses into the cell. Glucose that enters the cell is broken down to generate energy and heat for the cell to use, and the remaining glucose is synthesized as glycogen or as fat and stored in the cell. However, even if insulin binds to insulin receptors, glucose transporter sometimes does not open, which is called insulin resistance. When insulin resistance occurs, the cells cannot absorb glucose and the blood sugar level rises, and the condition of hyperglycemia stimulates insulin secretion again, so the insulin level in type 2 diabetes patients is higher than normal. Contrary to this, the phenomenon in which cells absorb glucose eagerly by obeying the commands of insulin even when a small amount of insulin is secreted is called good insulin sensitivity. In the fasting state, the human body uses the stored nutrients, but since the amount of glycogen stored in the muscle cells is small, the human body begins to decompose the fat stored in the fat cells as well. When fat is broken down, it becomes glycerol and fatty acids. Glycerol goes to the liver and becomes glucose again, and fatty acids move to muscle cells to be used as energy. Insulin resistance refers to a phenomenon in which blood sugar level rises due to the inability of some cells in the body to absorb glucose despite sufficient insulin secretion or a larger amount than normal insulin secretion. Insulin resistance has long been considered to be the cause of type 2 diabetes. However, it is not yet known exactly why insulin resistance occurs, or the relationship between insulin resistance and diabetes. Several risk factors that cause insulin resistance have been identified, including obesity, dietary habits high in fat and sugar, lack of exercise, family history, specific medications or diseases, and stress hormones. However, a causal link between these risk factors and diabetes is not clear, given that diabetes can also develop in skinny people, athletes, and vegetarians. Then all that's left is stress hormones. Certain medications or diseases are also caused by overuse of medicines that act like stress hormones or excessive secretion of stress hormones in the body. In this session, we learned that if you have insulin resistance, your blood sugar level rises because your muscle cells cannot absorb insulin even if your pancreas secretes more insulin than normal. In the next session, we will learn about the stress response that causes insulin resistance. This is Real Easy Med Terms. Have a great day. See you again.